Swollen feet are not just a comfort issue. I'm Dr. Sarah Williams from the UK, and tonight I'll show you what that swelling may be warning about.
By the end of this video, you'll know exactly what type of swelling you have, what to do before bed, and when waiting could put your health at risk.
I'm about to share information that can begin improving your life as early as tonight. If you struggle with swollen feet or ankles that make shoes feel tight, leave dents when pressed, or cause your legs to feel heavy and uncomfortable, you're about to learn a precise nighttime routine designed to help drain that fluid while you sleep. However, this is critical to understand. Foot swelling in older adults is not just uncomfortable. It is often a warning signal. Depending on the cause, using the wrong approach can be harmful, while the correct approach can be life-saving. Over many years working with cardiovascular and circulation-related conditions, every form of edema has appeared repeatedly, cases where ankle swelling was ignored for months and later traced back to serious heart issues, and others where medication side effects quietly destroyed quality of life. Thousands of older adults have successfully reduced swelling using the exact methods explained here, methods that address not only the fluid itself, but the root cause, so it does not return. What you're getting in this video is not general advice. You're receiving a complete diagnostic framework, how to identify the specific type of swelling you have, the correct bedtime strategy for each type, medications that commonly cause swelling but are rarely discussed, and warning signs that mean urgent medical care is needed immediately. Missing even one section could mean the difference between safely resolving swelling and ending up in emergency care. Not all swelling is the same. The solution depends entirely on the cause. Type 1 is dependent edema. This is caused by gravity. Sitting or standing for long periods allows fluid to collect in the feet and ankles because circulation is no longer strong enough to move it upward efficiently. This is the most common form in older adults and the easiest to manage. Swelling worsens throughout the day, improves overnight, and affects both feet equally. Type 2 is venous insufficiency. Here, the valves in the leg veins weaken, allowing blood to flow backward and pool in the lower legs. This causes swelling, aching, heaviness, visible veins, and sometimes brownish skin discoloration near the ankles. It often affects one leg more than the other. Elevation alone is not enough, compression and targeted movement are required. Type 3 is lymphedema. This occurs when the lymphatic system cannot drain fluid properly. The skin feels tight and thick, and pressing on it does not quickly rebound. Swelling usually begins in the feet and gradually moves upward. Past surgeries, radiation, or severe infections increase risk. Type 4 is medication-related edema. Many commonly prescribed drugs cause fluid retention. Blood pressure medications, pain relievers, steroids, diabetes treatments, and hormone therapies are frequent contributors. If swelling began shortly after starting a new medication, this is a strong possibility. Elevation alone will not fix it. Medication adjustment is required. Type 5 is cardiac or renal edema. This is the most dangerous form. When the heart or kidneys fail to function properly, the body retains large volumes of fluid. Swelling affects both legs equally, extends upward, and is often paired with shortness of breath, fatigue, or reduced urination. This requires immediate medical management. You can assess your swelling right now. Press your thumb firmly into the front of your shin for 10 seconds, then release. If the indentation remains for more than 10 seconds, this is pitting edema, ruling out lymphedema. Next, compare both legs. Equal swelling suggests dependent, medication-related, or cardiac causes. One-sided swelling suggests venous insufficiency or possibly a blood clot, which requires urgent care. Timing also matters. Swelling that worsens during the day and improves overnight is typically gravity-related. Swelling that remains constant or worsens overnight raises concern for heart or kidney involvement. Watch closely for warning signs: shortness of breath when lying flat, waking gasping for air, extreme fatigue, reduced urination, foamy urine, or facial swelling. Sudden swelling in one leg with pain, warmth, or redness requires immediate emergency care. Do not wait. For gradual, non-emergency swelling, this bedtime protocol combines 5 coordinated elements. Each works differently, but together they are highly effective. Element 1. Correct elevation. Feet must be elevated above heart level, not merely supported. This requires at least 12 inches of elevation using firm pillows or a leg wedge extending from ankles to thighs. Aim for a 20 to 30 degrees angle, with knees slightly bent. Elevation must be maintained throughout the entire night. Gravity then works in reverse, allowing fluid to return to circulation where kidneys can eliminate it. Nighttime urination is a sign this is working. Element 2. Daytime compression. Compression stockings are worn during the day and removed at night. Graduated compression, tighter at the ankle, looser upward, is essential. Mild swelling requires 15 to 20 millimeters of mercury. More severe venous swelling requires 20 to 30 millimeters of mercury. Stockings must be applied before standing in the morning, while legs are still fluid-free. Proper sizing is critical. Worn daily, replaced every 3 to 6 months. Element 3. Lymphatic drainage massage performed for 5 minutes before bed using light strokes, never deep pressure. Begin at the thighs and work downward, always moving fluid upward toward the torso. This primes the lymphatic system for overnight drainage. Element 4. Strategic hydration. Dehydration worsens swelling. Proper hydration allows kidneys to release excess fluid. Drink most fluids before 5 p.m., tapering afterward. Stop fluids 2 hours before bed. Sodium intake must be reduced aggressively. Excess sodium traps water. Aim for 1,000 to 1,500 milligrams daily. Avoid processed foods entirely. Improvement is often seen within 2 weeks. Part 6. Supplements and medication triggers. Element 5. Targeted supplements. Magnesium glycinate, 400 milligrams before bed. Potassium through food, not pills. Horse chestnut extract, 300 milligrams twice daily for venous insufficiency. Many medications cause swelling, especially calcium channel blockers, NSAIDs, steroids, certain diabetes drugs, and hormone therapies. If medication is the cause, switching, not masking, is the solution. Always discuss changes with your doctor. A structured evening routine ensures consistency. Elevation discomfort typically resolves within 3 to 5 nights. Modify positioning if needed. If already on diuretics, this protocol enhances effectiveness. It does not replace medical care. Those with heart, kidney, or liver disease must continue prescribed treatment. Sudden worsening, rapid weight gain, or increased breathlessness requires immediate medical attention. Part 8. Long-term impact, safety and final action steps. Empowerment. Foot swelling significantly increases fall risk. Reduced sensation, poor shoe fit, and medication side effects all contribute. Managing swelling improves mobility and safety, not just comfort. Your action checklist starts tonight. Identify your swelling type. Rule out emergencies. Review medications. Elevate correctly. Use compression daily. Reduce sodium. Hydrate strategically. Follow the protocol nightly for 2 weeks. If swelling resolves, excellent. If not, personalized guidance may be necessary. Before you go, subscribe for medically grounded guidance. Share this with someone struggling. Silently comment with what type of swelling you identified. Swollen feet are not a nuisance, they are communication. Listen early, respond correctly, and your legs can become comfortable again. Start tonight.